Atlanta, Emory University, Atlanta.
Hello, I'm Sarah Wise, Professor of Otolaryngology Head and Neck Surgery at Emory University in Atlanta, Georgia, in the United States. I'd like to thank the organizers of the European Rhinologic Society, as well as the chairpeople and audience for this session. Today, I'm going to share a talk on nasal destruction by opioids. These are my financial disclosures. Opioid use is a public health crisis in the United States of America. 11 million people have misused prescription opioids, and opioid-related deaths have increased over 4 times since 1999. Each day, there are 2,500 first-time users of prescription pain medicine, and this equates to 2.6 million new patients being prescribed pain medication each year. When surveyed, the public assigns most of the blame for the opioid crisis in the US to physicians who prescribe opioids, as well as individuals who sell prescription pain medications illegally. It's important to note, as surgeons, that the postoperative period is typically the point of first exposure to opioids. With regard to the use of opioids intranasally, the actual tablets are often crushed and inhaled along the nasal passages to provide enhanced onset and increased euphoric effects. There are also increasing reports of intranasal use of combined opioid acetaminophen medications. These include medicines like hydrocodone acetaminophen, sold by the name of Vicodin or Norco in the US, for example, as well as oxycodone acetaminophen, sold by the name of Percocet in the US. In addition, there are some reports of associated invasive fungal infections that are tied to intranasal opioid use, and we'll talk a little bit more about that later in the presentation. There is a nicely illustrative case series of intranasal opioid use, specifically with combined opioid acetaminophen medications, that was published out of the University of Pittsburgh in 2014. This is a case series of 7 patients, 57% were male, with age range 23 to 46. And as I mentioned, this is specifically a series of patients who inhaled crushed pills intranasally. The most common presenting symptoms were nasal pain and sinus pressure or pain, followed closely by nasal congestion and dysphagia. Otalgia and dysphonia were also noted in some patients. These pictures nicely illustrate what will often be seen inside the nasal cavity when patients crush and inhale opioid pills. There is typically a fibrinous material that can be white in color. There's often associated necrosis, and there can be septal perforations, palate fistulas, and erosion of the soft palate, each of which you can see here. CT images that are associated with the previous endoscopic images include things like soft palate erosion in image A, nasal septal perforation in images B and C, and palate fistula that you can see in image D. There can also be associated nasal cavity mucosal thickening and sometimes sinus mucosal thickening. In image C, you can also see that the inferior turbinate is eroded on the right. On pathologic examination, we can see several particular features of this entity. Necrosis is seen, which coincides with the endoscopic picture. Also, there's inflammation and foreign material, which can be non-polarizable as well as polarizable. In image D, you can see polarizable material with special lighting used. When patients present with this disease process, the differential diagnosis can include vasculitic granulomatous or even malignant processes. Typically, though, the laboratory workup for vasculitis